Thank you, Mr. Chairman, and thank all of you for being here. Obviously, this is a, excuse me, a very important subject matter. What has happened here has impacted healthcare professionals, but more importantly, it's impacted patients, and that's what we have to keep in mind. Look, I'm a big critic of the vertically integrated healthcare system that we have in our country right now. As a pharmacist for over 40 years, I experienced the vertical integration that exists where United Healthcare owns the PBM, one of the largest PBMs in the country, that owns the group purchasing organization, that owns the pharmacy, that owns the doctor, the largest employer of doctors here in our country, employing over 9,000 doctors, almost 10% of the whole medical field, or 10% of all doctors. And I'm just not a fan of it. And I think, and I've said, and I'll say publicly, that I think the FTC, more than any other agency, has failed the American people by allowing this vertical integration to happen. It needs to be busted up. But nevertheless, I wanted to ask you, and I kind of wanted to open it up and ask all of you, do you think it's more of a national security risk when a vertically integrated healthcare system like United Healthcare and Change Healthcare are not adequately protected against cyber attacks? Dr. Brueggemann, I'll start with you.
Yeah, I think, in my opinion, larger healthcare systems and entities vertically integrated have more points of entry that can be exploited. They have more money to pay when ransomware comes around than an individual physician practice, and therefore are a better target. And I think we should look at and study whether or not vertical integration is leading to or some component of the increase in cyber attacks.
Mr. McLean?
I think the answer to your question is yes, and the risks and the mitigations are widely varied depending on the organization and what we're dealing with. I think it is a national security risk because we are one of the 16 critical infrastructures, and if we're disrupted, then everyone is. And the cyber risks are just increasingly varied, and the defenses are not fail-proof.
Good.
Agreed. National security issue, especially when you have an organization like United that touches every hospital in the country, has access to 1 in 3 healthcare records, and has sensitive data on the military. Absolutely a national security issue, and these groups that attack us are provided safe harbor by hostile nation states. So they risk national security and public health and safety broadly.
Thank you.
Never looked at that issue specifically, although I will say that we are, as an industry, paying much more attention about verticalized concentration risks within IT ecosystems, and that's something that deserves attention in its own right.
Thank you.
Yes, healthcare is critical infrastructure, and critical infrastructure is designated as national security, just as electricity and telecommunications and financial services, water, transportation. We are in that category that should not have concentration of any one or few entities controlling that critical infrastructure.
Dr. Brueggemann, let me ask you, you're an independent practitioner. How is your practice responding to the interruption in claims processing and prior authorization denials? You know, when I was practicing pharmacy, I had my own pharmacies, you know, prior approvals. I mean, I had an employee totally dedicated to nothing but prior approvals.
Yeah, prior authorization has become an increasingly burdensome environment. The good news for me is I'm in Texas and we have a Gold Card Act. I know that we've looked at that at a federal level as well, but that has certainly helped us because I am actually a gold carded physician and am able to utilize that to reduce my burden. You know, we have used a secondary clearinghouse when we can. There are some secondary clearinghouses that are allowing us without an electronic agreement with them to be able to use them, but this has been a significant burden on our staff.
Right. Let me ask any of you, and look, I preface my remarks by telling you the way I feel, and you understand that. But have you heard of, are you aware of any circumstances, or any instances, I should say, where United Healthcare or Optum is exploiting physicians' cash shortfalls and resulting in Change cyber attacks to acquire struggling practices? Any? Please.
Yes. I mean, in the middle of March, I think we all heard about Corvallis Clinic in Oregon, which was acquired by Optum. They requested emergency acquisition as a result of shortage of cash flows, and the purchaser was Optum. So Optum purchased this clinic.
Anyone else? Thank you, Dr. Brueggemann. Yes, sir.
We are hearing the same reports. These really almost amount to
Mr. Chairman, how alarming is
practices.
this? How alarming is this? I'm at a loss for words. I just cannot believe this. Thank all of you for being here today. Mr. Chairman, we've got to address this situation. Thank you, and I yield back.